Red blood cells, RBCs, are the most common type of blood cell and are responsible for carrying oxygen to various tissues in the body. Normal RBCs are round, biconcave discs that are about 6 to 8 micrometers in diameter. However, there are several morphological abnormalities that can occur in RBCs, which can indicate underlying medical conditions. Here are some examples of RBC morphological abnormalities. Sickle cell anemia. In this condition, RBCs become crescent-shaped, rigid, and sticky, which can cause them to block blood vessels and lead to tissue damage. Spherocytosis. This condition causes RBCs to become spherical and more fragile, leading to hemolysis, destruction of RBCs, and anemia. Elliptocytosis. In this condition, RBCs become elongated or oval-shaped, which can cause them to get trapped in the spleen and lead to anemia. Poiklocytosis. This term refers to the presence of various abnormal RBC shapes, such as teardrop-shaped cells, target cells, and Burr cells. Poiklocytosis can be caused by various conditions, such as liver disease, thalassemia, and iron deficiency anemia. Acanthocytosis. This condition causes RBCs to develop spiky projections on their surface, which can be seen under a microscope. Acanthocytosis can be seen in various conditions, such as liver disease, beta-lipoproteinemia, and neuroacanthocytosis. It's important to note that RBC morphological abnormalities can indicate various underlying medical conditions, and a diagnosis should be made by a healthcare professional.